viewers, you're welcome to another edition of Mobilizing for Development. We're talking about a particular topic today, but before I do that, I have my guest with me in the studio. To my right is...
My name is Deborah Nuhu from Kachia Local Government, Kaduna State.
You're welcome.
Thank you.
And to my extreme left...
My name is Magdalene Adams from Kachia Local Government.
And to my left...
My name is Isiaku Kaswa, Kachia Local Government, Kaduna State.
And I'm your anchor, Mary Osman. And straight to the program for today. Mrs. Magdalene, I'm right, yes?
Yeah.
Mrs. Magdalene Adams,
Yes,
my question to you would be, what is the local emergency transport scheme all about?
Local emergency transport scheme is all about dealing with emergencies when they come. That is, finding a means of bringing these people with emergency cases to access services from the remote areas. So by establishing and then providing a vehicle ever ready when there's any emergency, the peak or any danger cases in form of illnesses, these vehicles will convey these cases to the hospital to access help.
That's a nice one. Malam Isiaku Kaswa, please, do you have anything to add to that?
Yes. It's a means test that help our communities that are in rural areas because of in terms of healthcare services.
All right then. This is Deborah Nuhu.
Yes.
My question to you would be, how did the local emergency transport scheme came about in your local government? How did it come about?
The local emergency transport scheme come about in our local government due to because of the maternal infants mortality is too much in the local government. That's why you have, when mobilizing for development came, they discovered that that one is too much. So they bring an idea of bringing this transport scheme to the local government to help people from the rural area to take themselves to the hospital for help.
All right, thank you. Ms. Madeline, do you have anything to add to that?
Yes. The local transport emergency transport system came about. It started by an NGO known as PAS 2 when they discover the number of maternal deaths being recorded in our health facilities, and they asked questions why it became like that, and the answers were that most of the people who come to the hospital, the women that are brought in the hospital to die, and they die because of one reason or the other along the way, is because of the hardship, the difficult terrain we have in Kachia local government, and lack of transport accessibility. So they now decided to think outside the box, and they feel, what do we do now? Because of the terrain, they say, let's look at a little vehicle that can be maintained by the community, that can be afforded, that can bring these women out of the rural areas to the hospital to access services. And then they came about instituting this emergency transport
Thank you,
system.
Ms. Madeline. And I will still be asking you, how does this emergency transport scheme, how does it work?
Well, the emergency transport scheme work within the community.
Just within the community?
Within the community. The drivers are there, they have been trained. We have TBAs that have been trained and given numbers of these drivers so that when they have emergency, they should immediately call them. And then when they call them, they convey these clients to the hospital or patient to the hospital.
So actually, all these people that work with this scheme, they are being trained. It's not as if they just come in, they are being trained. All right, thank you very much. What are the key advantages of the scheme? the key advantage? What are the advantages of the scheme itself?
The key advantages of the scheme are that at least it creates a platform between the local government and the community. The local government now know that when you involve the community in participating in some of activities, you gain their support. You gain their support. And when you gain their support, at least you can achieve what you have been looking for, or your goals.
This is very good.
Yes. So this local government now discover that it is a platform to interact with the community and making them to perform some specific function.
Okay.
Yes.
All right. Thank you. Ms. Deborah, was there a development organization that came in to assist in this process?
Yes, of course. Before part 2 were there, helping the communities in the local government.
Was it only part 2?
No.
Okay.
And then after that, the Mobilizing for Development came in. And then after that one, CHI still come in to help the communities and the local government to see the progress of the scheme itself.
Okay. All right, Mrs. Magdalene, please throw more light on that.
Actually, it is true. Part 2 started this program.
Okay.
Then they were using commercial vehicles. They didn't have a specific vehicle that can perform this function.
Okay.
So when part 2 came, when the developing for mobilizing for development now came,
okay,
and then decided, when they saw the indices of the maternal death rate, they decided that they will now support this program by providing a tricycle that will be conveying these very women with this situation to the hospital. And they provided 3 tricycles for the local government.
So is it that it's only 3 tricycles you still have, or you still have more that they've actually provided for you people?
Yes, when already Shopee provided 3, then developing for mobilizing for development provided 3,
okay,
and then CHI provided 9. So we have 12 wards in the local government. So the 12 wards now, virtually every ward has one mobile ambulance for that.
Okay.
And then the mobilizing for the development gave these 3 that they gave. We now assign them to how to reach
wards.
areas.
To other wards?
Yes.
All right.
To the same ward, with the other ward that they already have already 1-1. But those that have difficult terrain and had to reach areas.
Okay.
Then
Was
now
it to other wards that didn't have or already had?
They gave them 1, but because of their difficult terrain, the little ambulance they were given, the minibus, cannot access the road. So the tricycle could access those because the vehicle cannot pass through those roads. So they decided to give them another added one that they could deal with difficult terrain by giving them this tricycle, so that because the vehicles can move in form of using machine, and the rest can penetrate the deeper areas, the more remotest area, and bring these people out.
And were there challenges faced while setting up the scheme? And what can we learn from these challenges? The challenges that you faced, that were faced, and...
Well, the challenges that time that we have faced were more of the community. Because in the community, we discovered when it started, with the few, when they started, other communities were saying they will not go to other communities to access the services. And then it makes it difficult for the drivers themselves to cope with the challenges they were facing, because they became confused at a stage. When you call them for another in a different location, they will say, I won't go there because of one reason or the other, using cultural background, demography, and the rest, and their differences within the community.
So it wasn't even easy
to set it up.
All right, Ms. Deborah, how were the challenges resolved?
The challenges resolved due to the enlightenment given to the people in the community, due to the mobilizing for development. They make a platform, they call the communities and the local government officials, and they enlighten the people of the communities that those things bring the tricycle and the ambulance are not for one community.
Okay.
They are all for all the community to make use of them, because it's not for only one person to use it. That's the way we resolve the challenges.
So this was resolved in a way that they had to enlighten the community
Yes.
people that this tricycle itself was not for one community
Yes.
in particular.
Yes.
Apparently, this was the way they went about it and resolved it.
Yes.
Thank you very much. What was the lesson? What lessons are there for other local government that would like to replicate this scheme, that would like to go about this same process?
The lessons there that other local government could emulate is as a result of the reduction of the maternal mortality rate that has been reduced through the use of this transport system, by bringing these women with difficulties early to the facility and they access help, and they reduce the maternal mortality rate. And it's also create a platform for feedback from the community to the local government. And the community now know that the local government have them at heart, and the local government knows that when they interact, they form a sort of platform for interaction. They now know how to bring out problems that affect the community through their interaction, and then they go about planning how to resolve their problems.
My name is Yaku Kaswa.
Ma.
Please, do you have anything to add to this? To
Yes.
what you have said?
So in our work, we realize that there are some settlements that are hard to reach.
Okay.
So we keep them awareness about the emergency machine.
So that's to say there are local government that this scheme has not reached. So therefore, there's a way you people are trying so that you can reach them. But in this case, I'm trying to ask, how can other local government try to go about this if they want to?
We use in every ward we have ward development committee.
Okay.
So they were find out to analysis to negotiate with some various wards
All right then. Thank you very
for
much.
the assistance.
Mr. Burrow,
Yes.
can you add something to it also? That's here.
Yes, of course.
How can other local government
Government learn from us,
this and
from
even
this
want to go about
transport
it?
system.
Yes.
Yes, the way other local government will learn from this transport system is that since they have seen what our local government has done and is improving, that is
The life of
reducing
the
the life of people,
Yes.
is improving. So now people are not dying like before, women are not dying like before, and then children are not dying like that. So it will make other local government to think of our local government to come and learn something from us. What ways do we take to reduce this maternal death? So other local government will learn from us the way we did it, and then they will pick up and then go to their own local government to introduce the system.
Thank you very much. If you're just tuning in, it's still Mobilizing for Development, and we are talking about local emergency transport scheme. Ms. Madeline,
Yes, ma'am.
how has the scheme helped community members to participate in governance policy? Like how
Yes.
has it helped them to be involved with governmental policy?
The scheme has really helped the community members because it has drawn the community members closer to the government, and it is hearing their voices now. They are getting feedback from what the activities they are doing in the community, because right now, like in health department, we have figures, data to tell you what they have been bringing as a feedback to us, and making us to know that the community are participating and people, those working are doing their work. And the local government is helping the local government again to make plans that, looking at what is happening, they want to at least whether to enlarge the scale or to modify it to make it better because of what is happening, the interaction they are going through, between them and the community. And is making them harvest data for quality planning. And because our maternal mortality rate is reduced.
It has reduced.
It has reduced. Because last year we had about 5 maternal deaths. And you know what it means, just having 1 maternal death. But for now, As from January to up to date, we've not gotten any.
So this scheme
has really reduced the maternal mortality rate to a BRS money minimum.
That's a very, very good one. And Ms. Deborah, does this scheme help to build relationship between communities? Has this helped build relationship between the communities?
Yes, of course. It helped communities to build a relationship, because like one before, people doesn't like others to go to their houses to see the people that are sick because of some evil things they do. So, but now, since the Mobilizing for Development have enlightened people or create awareness and tell people that these things is good for us to relate together to see the progress of our people, to reduce the maternal deaths of our people. That's why it has created a relationship between the communities. Not one community, many communities. It has make a relationship between all those communities.
This has bring more communities together closer, to be able to relate more and understand how to even go about it.
Yes.
Thank you very much. Has this scheme helped to create a more responsive link between community members and policy makers?
Yes, of course. It has really helped in creating a link, because in a situation where we are having more deaths, maternal deaths before, and the community look at it and nobody cares. But because of this transport system, the community now know that the government have them at heart by creating a way of bringing the people with situation that need emergencies to bring them to where they can get access to solving their problems, their health issues. And this has made them, the community itself, have made them welcome this idea, because the news is all over that around our area there, the news is all over that they should come to Kaja, emulate, because they have seen what is happening and they are happy over what is happening, and the people, the community can go directly to the local government to cry out, because this is a platform for them to cry out their heart, and because they have cried out their heart and they have heard them and they have provided this means to solve their problems.
Thank you very much. So, Madam Isiako Kaswa, do you have anything to add to what she has said before?
Yes, I will add a little.
All right, sir.
I will talk about our ward because of mobilization for development. So we are now in this situation, our communities, we have networking within the ward without any religion or tribalism bias. So we try our best under our forum to enlighten our people, to put hands together to see we are living peace in the areas.
And more on how the scheme can work better for
yes.
the people. All right, sir. Thank you very much. All right, I hate to go, but time is of the essence and time is not in our hands. For further information, the number to send your SMS is 081-6817-4589, and the website is www.mobilizingfordevelopment.com. And to my guest in the studio, thank you very much for coming.
Thank you.
I'm your uncle, Mary Usman. Have a great day.
Thank you.